Thank you very much, Gary. And it's my pleasure to join these two very esteemed presenters and talk about my experience and my philosophy of Aquamid. It's my disclosure. I'd like to just run through a brief introduction. Why do I feel that Aquamid is good for your practice? Talk a little bit more about safety and the experience with Aquamid, indications, instructions for use, managing adverse events, and clinical results. Well, why are we all interested in this filler market? Because our patients are demanding more and more non-invasive procedures, as been clearly demonstrated by the US figures. And the increase in filler use is substantial over the years and is continuing to grow. We see in the European market, the filler market has been growing steadily. So there is a need for us to improve our products, improve what we offer our patients, because our patients need better treatments. So patients are concerned by the need, as the previous speakers have said, by the need for repeated injections associated with downtime. Even with very good injectors, with hyaluronic acids, they can get bruising, they can get swelling. They don't want this. They don't want to have to come back and have this done every 6 months. Patient satisfaction is a key driver for customer loyalty, patient loyalty and return visits. And in the survey in the US, 90% of US physicians felt that having a longer lasting filler would be beneficial for their patients. So there is a need. Are permanent fillers without risk? Of course they're with risk, because they are long-lasting. But we use breast implants, and we've seen recently in Europe and around the world the chaos that has ensued by a poor quality implant. And it is very important that when we look at long-lasting products, and we should look at all products, that we ensure that we're using a very safe and a very reputable product that's been well tested. But we use all of these products. As a plastic surgeon, I use these products week in and week out. And they do have risks. But I mitigate those risks by safe practice and make sure that I'm using the safest products that are available. That doesn't mean I don't do these procedures. Permanent fillers exist in all aspects of medicine. We use hip and knee prostheses. We use facial implants. We use cements in orthopedics and dentistry. We use cardiac stents. The benefit of these procedures far outweigh the risks, but they have significant risks. Aquamid should be considered in a similar manner. It has the same potential risks, but also the significant benefits. We need to ensure that when you use a product like Aquamid that's long-lasting, that you pay good attention to good medical principles and ensure that you provide a safe treatment. It's not a cavalier injectable. I've had a lot of discussions with a company about removing Aquamid from this injectable market, because it's not an injectable, as we said. It's an implant that happens to come in a syringe. Is it an ideal tissue filler? I think it comes very close. It's very highly biocompatible. There's no immunogenicity. It integrates with the surrounding tissue, has good viscosity, causes minimal fibrosis, as you've seen in the histology slides. There's little inflammatory response. The volume is related to the volume injected. There's no re-injections required to maintain this. Some people will require some top-ups over years, and it's incorporated well. As we said, the properties of Aquamid means that it's solely dependent on the volume that's injected. There's no need to overcorrect. There's no foreign body reaction, and I'll show you some more histology as well. There's no hardening, there's no fibrosis. What impressed me with the product is the patients will come and say, this is actually much softer than the previous fillers I've had. It fully integrates. It's revascularized. There's no immune response. Because of this water exchange, there is a prevention of encapsulation. I also used bioalchemid in the very early days. And the company, Polymicon, emphasize that the product should not be interfered with for 2 weeks to allow encapsulation. The only way that they were able to stop migration of the product is by ensuring that the product became encapsulated. Well, that's totally illogical when you're dealing with a product in a tissue. There's very few or no cases of allergy or hypersensitivity or fibrosis, inflammatory, and granulomas have been reported with Aquamid. Similar to all fillers, the adverse events occur at the time of injection, and they're usually transient. They're local, they resolve spontaneously. Adverse events do include some redness and bruising and swelling, like all fillers, hematoma formation from a needle injection, itching, and some pain. As with all transcutaneous injections, the major concern is the transport of bacteria through the skin into the site of injection. And therefore, bacterial contamination of the product is the single most important cause for early and late adverse events. So we have to minimize the risks of complications by careful patient selection, patients who have very poor hygiene, patients who have very poor dental hygiene, patients who have recurrent skin infections are probably not an ideal candidate for Aquamid or for any other facial implant. Careful selection of indications. Make sure that it's a good indication for a long-term product. It cannot be emphasized more, and Gary and Rhoda have emphasized this, about sterile injection technique, because like with all implants, whether it's a breast implant or a chin implant or a facial implant, the single time that implant is at risk is at the time of implantation. That's the greatest risk to that implant. So it's very important to adhere to post-treatment instructions. As we've heard previously, the complication rate recorded for Aquamid is less than 1 in 1,000. I think the histology is very, very impressive, that there's no encapsulation with the product. And we see this fibrous ingrowth into the product even at 14 months. Sorry, there you go. And you can see the collagen fibers growing into the product. And that's a really good sign, because it means that the tissue, the body, is not trying to reject this, but actually accepting it and growing into it. And here we have, at 4 years, there's no encapsulation of the product, and there's tissue ingrowth. And I think that's a very positive sign. There's some, as the previous speakers have intimated, there's a lot of permanent filler myths. But we look at some of the facts. Permanent fillers are all the same. I think Rhoda has clearly answered that. They're not safe. I think that all of the data that we have shows that the correct long-term filler used correctly is safe. Permanent fillers equal permanent problems. I completely disagree, and I hope we were able to convince you that they can cause permanent problems if they are poorly used, they're used in the wrong patient, and any adverse events are not managed appropriately, like any implant. The long-term aesthetic results are not satisfactory. Well, we'll show you some long-term clinical results with very good outcomes. A temporary solution is not always the best solution, because patients want long-term results. They are increasingly moving towards wanting a result that lasts longer than 6 months or a year. Permanent fillers treatments are not reversible. Well, they certainly are. Again, with the knowledge of how the product behaves, it is certainly possible to remove the product 5 years later or 10 years later. And it's certainly beneficial for your clinic. The histology, looking at the scanning electron microscopy, is very, very good, because, again, we show with the difference between Aquamid and BioAlchemid, where you have a very dramatic foreign body reaction with encapsulation of BioAlchemid and complete integration of Aquamid. This is the long-term aesthetic results are satisfactory. Well, again, this gel behaves in a very soft, natural manner. Patients have reported time and time again that the product feels a lot more natural than previous products that they've had. there's no loss of volume over time. So patients don't go through this swinging cycle of looking good, then deteriorating, then looking good again, then deteriorating. And again, we said more than 90% of patients are very satisfied up to 5 years after Aquamid treatment. Permanent fillers are not reversible. Again, come back to this. It's intended to provide a long-lasting result, but it's possible to remove it if it's been overtreated, if conditions with the patient changes. And it can be removed by either needle aspiration or a simple stab incision. Complications with Aquamid, like we said, edema, redness, minor hematomas, usually last for a few days. If symptoms of things like tingling, swelling, redness persist, then infection must be assumed. Again, we're talking about an implant. If we had a breast implant with a patient who came back after a week with redness and swelling, we would absolutely say that this is an early infection and treat this patient aggressively with antibiotics. Well, the same thing applies with Aquamid. We need to recognize that early infections can occur and treat these aggressively with antibiotics. Corticosteroids and non-steroidals should not be used because it actually enhances the inflammatory response in these patients and you progress the infection. You start broad-spectrum antibiotics immediately and, if possible, do a fine needle biopsy. Yeah. So allergies and hypersensitivity have not been reported, and there's significant scientific evidence that complications of Aquamid are related to bacterial infection, and these infections need to be treated urgently. So in order to minimize risk, as we said, carefully select patients, use sterile and aseptic techniques, consider using prophylactic antibiotics. I do. I know Dr. Ribe in Spain doesn't use routinely prophylactic antibiotics. I think for reducing the risk of bacterial contamination is important, and therefore we do use prophylactic antibiotics with these patients. Advise the patients about the post-injection do's and don'ts. Inform the patients about the possible side effects, complications, so that they're well aware. They inform your staff immediately if they feel any of the swelling, significant swellings or tingling sensation or pain, and start on antibiotics if there's a suspicion of infection. And if the infection doesn't resolve after the initial course, the recommendation is to switch to clindamycin and tetracycline for a 2-week course. And this will usually resolve the infection. Again, important for the good governance is make sure that you do report side effects and adverse effects to the company so that the proper recording and the proper surveillance of the product is carried out. The only way that the company knows if there's a problem is if we report them. So in conclusion, I think Aquamid is a safe and effective product for facial and body soft tissue filling, and it provides very satisfying aesthetic results for patients. It does have a long-lasting effect as shown by high patient satisfaction up to 5 years and now going on to 10 years. It certainly is a safe product, but complications do occur, and therefore we have to minimize the risks and treat adverse events quite judiciously to ensure that these are minimized. Thank you very much.